Welcome to this clinical case discussion in ophthalmology, and today we are going to discuss a case of oculoplastic which is Epiphora, which is pretty common. And before we go into this case, we'd like to discuss the anatomy of the nasolacrimal system, which would include the puncti, and then you've got your vertical canaliculus, the horizontal canaliculus, the common canaliculus, nasolacrimal sac, and then you go on to the nasolacrimal duct. The obstruction can be usually at three levels: at the canaliculus, at the sac and the canaliculus junction, at the sac and the nasolacrimal duct junction, or at the lower end of the nasolacrimal duct. This is a patient who's 59-year-old. She complained of Epiphora, and there was nothing else wrong with her basically. So we went on for nasolacrimal syringing, which you did punctum dilation. After that, you go in vertically with your syringing cannula, and then you move it horizontally along with the inferior canaliculus. And then you need to inject the fluid, and the fluid either usually will go all the way down. That means that the nasolacrimal duct is open, or the other option which will happen is you get reflux from the upper punctum, which usually happens if there's blockage at the common canaliculus or at the level of the sac. So those are the basic levels of obstructions which you need to get. So with this patient, what we went on to do was a dye dilution test. We instilled fluorescein drops, and then we checked for the excretion of the dye over 5 minutes. So we're basically checking under fluorescein. And here you can see after 5 minutes, significant amount of fluorescein has already drained. So the next step was to go and do an anterior segment examination, for which the most important is to check for the tear leg. So significantly, not quite a bit of Epiphora, or the tear leg is pretty much within normal limits. And then you have to see for the palpebral conjunctiva, there's no papillae or follicles there. Then you see for the punctum, there's no punctal stenosis or punctal occlusion on one side, and then you go on to check for the other side if there's any problem in that punctum. So our next step is to go and do a punctum dilation with a punctum dilator. Nettleship dilator usually is used. The important thing is you have to be very gradual with this. Do not push it. I've seen people pushing it, and that tends to cause the sphincter of the punctum to get ruptured, and then they tend to have a very large size opening of the canaliculus. So it needs to be very gentle. So you're going to do it under topical anesthesia. So you're using proparacaine. So the patient can only accept very gentle dilation. So the important thing is to rotate that thing, rotate the dilator in there, and just put it and push it gently forward so that the patient does not feel any pain in that thing. So once you've done that, and you can see the amount you want to go in is such that the thing opens up. So once you've done that, then you would come in with your syringing, and the syringing, for that you need a lacrimal cannula. So here the lacrimal cannula, so it's been slightly modified so that it easily goes into the nasolacrimal passage. Here you can see I'm doing it on a slit lamp, so it easily goes in, and you just inject it, and there's no reflux from the upper punctum. So that tells you that the patient's lacrimal system is open completely on the right side. So you tell the patient there's going to be a salty water which is taken out from a normal saline infusion bottle, so it's pretty safe to swallow that thing. So here you can see I went inside. Sometimes you just come back outside. So you vertically go inside, and then you go on horizontally. It is very important to go in line with this. So then you gently inject. So I did not do any probing. I'm just doing just punctum dilation, and then you do syringing. And in here as well, there's good flow into the through the lacrimal system, and the patient felt there might be a little less fluid, so I just did it again, and then patient felt that it was the same on the other side. So the important thing, we found out that the nasolacrimal duct was open in this patient. So typically in a patient, when you see ducts are open, you tend to give them anti-allergy drops, which is usually the cause of Epiphora in these cases. Thank you very much for being with us and listening to this talk, and we look forward to seeing you again. Thank you very much.